Hello, this is Dr. David Green, CEO of the Ohio Pain Network. Today's topic is what you need to know about fibromyalgia. Fibromyalgia is a connective soft tissue disease involving chronic, spontaneous, and widespread musculoskeletal pain, along with some fatigue and sleep disturbance. It presents with multiple tender point spots on the body that are primarily found on the back, the neck, the chest, the hips, the arms, and the legs. Years ago, it was referred to as chronic pain syndrome, and then psychogenic rheumatism or fibrositis. Some of those are interchangeably used today. How common is it? 3.4% of women in the U.S. and 0.5% of men have it. Typical age range is 30 to 50. 3/4 of those actually go undiagnosed, so those numbers are actually much higher. How do you know if you have it? Well, there's several guidelines. The American College of Rheumatology has these history of several areas of aches or pains for at least 3 months. At least 11 of 18 locations on the body that are significantly tender. You can see the diagram of the tender point areas on the front and the back. And if it's close but not quite, it's myofascial pain syndrome is the diagnosis. It's got the same treatment though. There are some older guidelines from the American Medical Association. Generalized and chronic aches, pains, and stiffness for over 3 months in 3 or more areas, multiple tender points, and then no other identifiable condition that the symptoms could represent. There are also some minor criteria, including generalized fatigue, chronic headaches, neck and shoulder pain, sleep disturbances, bowel irritability, and subjective numbness and swelling. Oftentimes, it simply becomes a diagnosis of exclusion. The doctor will go through the differential as far as what it could be, and if it doesn't fit, down the line, fibromyalgia is usually the diagnosis of choice. What are the treatment options? Well, as far as alternative medicine, the Mayo Clinic came out with some validated options that include acupuncture, chiropractic, physical therapy, massage, aromatherapy, homeopathic medicines, spa baths, relaxing herbals, music therapy, and yoga. All of these have shown to be of benefit. There are some various medication options, which include antidepressants, which are used off-label. There's some various non-steroidal anti-inflammatories, muscle relaxers, Tylenol, opiates, membrane stabilizing drugs such as Lyrica or Neurontin. There's sleeping aids. And there's a Myers cocktail IV infusion treatments, which is a combination of vitamins and minerals that are infused, and there's been some smaller studies showing exceptional benefit with this. There are some FDA-approved medications. Lyrica was the first one approved in 2007. Cymbalta came a year later in 2008, and then Savella was approved a year after that in 2009. The interesting thing is that we don't really know how any of these medications work, but we just know that they do. How well do the overall treatments work? Well, outside of those medications that are FDA approved, the Myers cocktail had a pilot study in 2009 with most subjects experiencing relief, but it just wasn't a large enough study to have statistically significant differences. There really is no cure. Fibromyalgia is a very challenging condition. The National Fibromyalgia Association says that new studies show patients can decrease symptoms dramatically through multimodality treatments such as what we just discussed. The top non-operative pain management in Ohio is through the Ohio Pain Network. There are many clinics participating throughout the state, accepting over 50 insurances with the board-certified award-winning doctors. Visit us online today at ohiopainnetwork.com and then call us for more information and scheduling at 888-466-9898. Once again, 888-466-9898. I'm Dr. David Green with the Ohio Pain Network. Your pain stops here.